Hi teeth experts, welcome back to the channel. Today we're talking about medical emergencies that arise due to cardiovascular reasons. The first one is not actually a condition. It's a very important symptom that initiates or supersedes all these cardiovascular conditions. And it's our friend acute chest pain. Now let's start by asking ourselves, what is acute chest pain? It's a sudden severe pain that happens in the retrosternal area. Where is this retrosternal area? If you look at this thoracic cage, also known to us as a rib cage, it's this flat structure which is now in red in the center of the rib cage. That structure is called the sternum. Retro in Latin means behind. So the phrase pain in the retrosternum literally means pain behind the sternum. When patients describe this, they use specific keywords. Those being sharp pain, crushing pain, or sometimes they will say, my chest feels tight, or I have a heartburn, or sometimes they even say, there's a lot of pressure in my chest. It almost feels like there's an elephant sitting there. Acute chest pain can happen in patients with no history of heart disease, but it's more common in certain groups. Those being people with known ischemic heart disease, patients with previous angina or MI, older adults or diabetic patients. So these would be our higher risk patients. Which takes us on to angina. So what is angina? Angina is a type of temporary chest pain which is caused by reversible myocardial ischemia. It in very simple terms means that the heart is not getting enough blood and oxygen for a short period of time. The main or the most common result or the most common reason angina will happen is because of coronary artery disease. So here, in this disease, the fatty deposits, which are known as plaques, build up inside the coronary arteries. And that narrows the space through which blood can flow, just like this photo. In photo A, you can see that it's just the artery and the blood flow, which is mimicked by the blue arrow. And you can see that there's no deposits, there's no obstruction over there, so the blood can flow very easily, regardless of when the heart needs it, during rest or during exercise or fight or flight. If you look at photo B, though, you'll see that that's the same artery and the same blood flow. The only difference here is that you've got the fat deposits now, which is yellow. The fat deposits are obstructing the route for the blood flow, so not enough can go through. Or even if there is enough going through, the blood pressure is not enough. Because the blood flow and the oxygen isn't enough when the heart needs it, this is what causes the temporary ischemia, and so that's what produces the angina pain. Now, the patient will typically say that they feel some sort of tightness or pressure in the central or retrosternal area, like we explained in the previous slide. This pain comes during exertion, or it can come during emotional stress. The angina episode lasts 2 to 10 minutes, not any longer. The most important thing that we need to know about angina is that it does not cause permanent damage to the heart. The symptoms settle as soon as the heart's oxygen demand reduces, which is why we say when this happens in a medical emergency, always ensure that the patient rests. And in patients that have a history of angina, they will most likely have their GTN with them. So GTN stands for glycerol trinitrate. And if they don't have it with them, then you will just grab yours from the medical emergency kit, spray it under the tongue, and then just wait, and the patient will be getting better, unlike myocardial infarction. A myocardial infarction is defined as a heart attack that's caused by complete blockage of a coronary artery. This leads to death of the cardiac muscle. The typical features of myocardial infarction are severe persistent pain in the chest that lasts for longer than 20 minutes. It's not completely relieved by GTN. Here, the pain may radiate to the arms, most commonly the left arm, to the jaw, to the back, and to the neck. The patient may start sweating, their skin might be clammy and pale, They may complain of nausea, or they actually vomit. The patient will be short of breath, so they'll experience breathlessness, and they will feel this sense of impending doom. When it comes to management of angina and myocardial infarction, if known that this patient has angina and their symptoms actually match angina, you must stop the procedure immediately. You will sit the patient upright, you will reassure them, monitor their pulse and their breath rate. Administer GTN spray, so that's going to be 1 to 2 sprays sublingually, so under the tongue. Repeat after 5 minutes if required. You will also give this patient high flow oxygen, only if their oxygen saturation is below 94%. So this is according to the Resuscitation UK guidelines. If the pain resolves within 5 minutes, that means that's going to be stable angina. Cancel the treatment, however, and advise the patient to go to their GP or get a cardiology review. If the angina does not resolve after 2 doses of GTN, then you're going to treat it as a myocardial infarction. When will you assume it's myocardial infarction? So like we said, if it's not resolved by GTN, if the pain persists for longer than 10 minutes despite GTN, if the pain is unusual and severe, the management here is going to be, you need to stop treatment, you need to call the emergency services, so that's 999, position the patient in an upright position, okay, unless they faint. If they faint, then put them in the recovery position. You're going to give them aspirin, that's going to be 300 milligrams to chew, if they are not allergic to it. So make sure you've got someone with you that is able to tell you if you've got any allergies or not. You're going to assess this patient using the ABCDE. So you're going to check their airway, breathing, circulation, disability, and exposure. You will give them oxygen and then be prepared to treat this patient for cardiac arrest, which is going to be covered in a different slide. I have added a few questions for you. I guess give them a try, see if your answers are correct. Okay, my friends, and that brings us to the end of this video. In the next coming videos, I will follow the schedule that I posted on Instagram, and I'll just add a screenshot of it here. And after that, we should start the actual medical conditions.